Many people believe that traditional squats are the ultimate solution for maintaining strong glutes as they get older. While squats have their place, they may not be the complete answer for adults past 50, and in some cases, they might even contribute to problems rather than solving them. Performing squats without ensuring your glutes activate properly can lead to compensatory patterns where the stronger side takes over, potentially worsening imbalances and leading to hip discomfort, knee stress, and continued weakness. Research indicates that older adults who focus solely on compound movements often experience more joint discomfort compared to those incorporating targeted seated glute exercises. The seated approach has demonstrated superior benefits for muscle balance and hip stability, which are crucial for maintaining independence and preventing falls. Your gluteal muscles, particularly the gluteus maximus and gluteus medius, play roles far beyond aesthetics. These muscles are fundamental to hip stability, proper posture, balance, fall prevention, lower back protection, and efficient movement during daily activities. As we age, these muscles often become less active, especially with prolonged sitting, walking without resistance training, or unconsciously favoring one leg due to previous injuries. When glutes don't fire evenly, consequences ripple through your entire body. Your pelvis may tilt unevenly, your spine might compensate with rotation, and your knees and lower back absorb forces they weren't designed to handle. Over time, this manifests as pain, postural problems, and increased fall risk. Even with regular exercise, imbalances can undermine progress, causing one leg to feel consistently weaker, lower back soreness after activity, or a subtle hip drop when walking. The encouraging news is that these issues can be corrected without heavy weights, high-impact movements, or gym equipment. What's needed is an intelligent, targeted approach designed specifically for bodies over 50. Let's explore 3 evidence-based seated glute exercises that are safe, effective, and perfectly suited for mature adults. The first exercise is seated hip abduction. While pushing your knees apart while seated might seem too simple, this movement specifically targets the gluteus medius, a side buttock muscle that becomes increasingly underused with age. This muscle plays a critical role in single leg balance, preventing hip drop during walking, stabilizing the pelvis, and protecting your knees and lower back. After 50, we naturally lose muscle mass in stabilizing muscles, and prolonged sitting causes them to become less active. When you only perform squats or walking, you might strengthen your dominant glute more than the weaker one, worsening the problem. To perform seated hip abductions, sit upright in a sturdy chair with feet flat and knees bent at 90 degrees. Place a resistance band just above your knees, lean your upper back slightly into the chair, and keep your core engaged. Press your knees outward slowly and with control, avoiding bouncing. At the widest point, pause for 1 to 2 seconds while squeezing your glutes, then slowly return to start. Begin with 10 to 12 repetitions, progressing to 15 to 20 as you build strength. If one glute is weaker, try keeping one leg stationary while pushing only the weaker leg outward against the band. This isolation builds the mind-muscle connection on that side. Always start with the weaker side and consider doing extra sets or repetitions to help it catch up. Without a resistance band, place your hands on the outside of your knees and press outward while resisting with your arms. The second exercise is the seated glute bridge or hip thrust from a bench. Despite its simple appearance, this movement activates substantial glute muscle fibers with minimal joint stress. Unlike squats, this exercise doesn't rely heavily on your knees or back. It teaches your glutes to perform their primary function of extending your hips powerfully and safely, allowing you to control range of motion, protect joints, maximize glute engagement without compensation, and progress at your own pace. To perform this exercise, you'll need a stable bench or couch approximately 16 inches high. Sit on the floor with your upper back against the bench edge, positioned just below your shoulder blades. Bend your knees with feet flat, shoulder width apart, close enough that knees form a 90-degree angle at the top. Tuck your chin slightly and look forward. Press firmly through your heels, squeeze your glutes, and lift your hips until your body forms a straight line from shoulders to knees. Pause at the top for 1 to 2 seconds with glutes contracted, then lower with control. Start with 10 to 15 repetitions, emphasizing quality over quantity. Avoid pushing through your toes instead of heels, overarching your lower back, not achieving full hip extension, and letting your neck drop backward. To increase intensity, add a resistance band around your knees, slow the movement to 3 seconds each direction, extend the top pause to 5 seconds, or add small pulse repetitions at peak contraction. The third and most crucial exercise is the single leg glute bridge, which specifically addresses muscle imbalances. Even with regular exercise, you might feel one leg is stronger, one hip drops when walking, or notice asymmetry. This isn't imagination or simply aging. It's glute imbalance, remarkably common after 50. Most people skip single leg variations because they seem too challenging or too basic. But this movement could be the critical element for achieving better balance, improved posture, and glutes that function evenly. After 50, muscles naturally decrease in size, particularly smaller stabilizers. Without realizing it, you may favor one side through sitting position, standing weight distribution, or overcompensation from past injuries. One glute can become 30 to 40% stronger than the other, creating uneven force distribution through your hips, knees, and spine. Bilateral exercises allow the stronger side to dominate, while the weaker side remains passive. The single leg glute bridge eliminates this compensation by forcing each side to activate fully and independently. To perform this correctly, lie on your back with knees bent and both feet flat, hip width apart. Place arms by your sides with palms down and engage your core. Extend one leg off the ground, either straight or slightly bent, while keeping the other foot flat near your glutes. Ensure hips remain level without sagging. Drive through the heel of the grounded foot, squeeze your glutes, and lift your hips until your body forms a straight line from shoulders to knee. Pause at the top for 1 to 2 seconds, then lower with control. Start with 6 to 10 repetitions per side, eventually progressing to 12 to 15 with perfect form. If one side is significantly weaker, begin with that side and add extra repetitions or sets. Monitor your hips to ensure they rise evenly. If one side sags, reduce difficulty by bending the lifted leg or decreasing range of motion. Lightly touching your glute during the lift improves neuromuscular connection. Keep your core tight to prevent lower back arching. Move slowly to maximize muscle engagement and maintain proper breathing. This exercise is more than just a glute strengthener. It's a recalibration tool that trains your brain and body to work harmoniously. Most glute training assumes both sides are equal, but for people over 50, especially those who sit frequently or have old injuries, equal strength is rarely the reality. Without addressing this imbalance, traditional exercises won't deliver complete benefits. Remember, after 50, more isn't always better in fitness. You don't need heavy weights, high-impact routines, or to push through pain. You need precision and movements appropriate for your current body. These 3 exercises work together to reactivate the gluteus medius for improved hip stability, build total glute strength safely without straining joints, and correct muscle imbalances while reinforcing pelvic alignment. This approach isn't about achieving perfection. It's about building a body that supports you in balance, movement, and confidence during everyday activities. Start gradually, maintain consistency, and always prioritize proper form over intensity. The combination of seated hip abduction, seated glute bridge, and single leg glute bridge creates a comprehensive routine that addresses the unique needs of bodies over 50, focusing on correction, balance, and sustainable strength development. Please note that this information is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your physician or qualified healthcare provider before beginning any new exercise program, especially if you're over 50 or have a history of injury, surgery, or chronic conditions.